Hey, this is Dr. Paul Firnhaber, and it's time for another 10 minutes of truth. So today I've got an article from a recent study in a journal called Health Science Reports. The date on the study is September 19th, 2025. So, about 3 months ago. The name of the article is called Association Between Spinal Manipulative Therapy for Lower Back Pain with or Without Sciatica and Opioid Use Disorder, a Retrospective Cohort Study. And what this study aimed to do is look at two very large groups of people. One that both these groups had lower back pain. Some had sciatica, some didn't. One group was prescribed ibuprofen for 2 years. The other one got chiropractic care for 2 years. Both of the groups were right around 46,000 people. So it's a very large study. The aim of this study was to investigate the association between chiropractic care and the risk of developing opioid use disorder in opioid-naive adults with a new episode of lower back pain with or without sciatica compared to propensity-matched controls prescribed ibuprofen over a 2-year follow-up. So over 2 years, half the group got ibuprofen, half the group got chiropractic care. The article states this: studies have found that those visiting a chiropractor and or receiving chiropractic care are less likely to be prescribed opioids. In 2021, a study of adults with chronic lower back pain, spinal manipulative therapy was associated with a lower incidence of opioid dependence or abuse compared to opioid therapy over 12 months by approximately 4,700%. So the chiropractic group had a 4,700% less chance of developing opioid addiction. In this particular study, the chiropractic care cohort had a significantly lower incidence and risk of opioid use disorder compared to the ibuprofen cohort by about 600%. The spinal manipulative therapy cohort had significantly lower incidence and risk of opioid use disorders by approximately 500%, long-term opioid use by approximately 400%, opioid prescription by approximately 150%. The article goes on to say, and listen to this, this is really, really important. Recent guidelines from the American College of Physicians, this goes back to 2018, and the Center for Disease Control, 2022, have encouraged non-pharmacologic interventions rather than opioids for lower back pain, thereby potentially reducing our observed opioid use disorder incident. This study and prior studies observed a lower risk of long-term opioid use among chiropractic care recipients. In this article, under the recommendations, it says, our findings suggest that a reduced risk of opioid dependence is associated with spinal manipulative therapy for lower back pain may have implications for health policy. Payers, including Medicare and Medicaid, such as in this current study, could consider real-world data to support expanding coverage and reimbursement for non-pharmacologic treatments such as chiropractic care, which often faces stricter condition requirements, visit limits, and or higher out-of-pocket costs compared to other conservative care options. To prioritize non-pharmacologic care and lower back pain management and potentially mitigate opioid use disease risk in an opioid-naive patients with new low back pain, primary care providers and pain management specialists couldn't consider early care pathways to chiropractic for spinal manipulative treatment. So this is very interesting because they're recommending, and this study was done by researchers, by chiropractors, and by physicians. And what they're saying in this article is that really, when people come in for lower back pain to a physician, they should really be referred out to a chiropractor. That's essentially what they're saying. Now, that's really interesting. I don't know how many physicians have seen this article, read the article, or even care about the article. I get some referrals from physicians, but very few. This article is saying that basically pretty much anybody that comes into their office should be for lower back pain or sciatic pain should be referred to a chiropractor first before they're ever put on any medication. And the wheels of the government, and you could say a lot of things, grind very, very slowly, but they grind exceedingly fine. And eventually, chiropractors will be the profession of choice for lower back pain and sciatica. I don't know if that will happen while I'm still practicing, but it will happen. It has to happen because eventually studies like this and other studies, many other studies that have shown the same thing, will just propel the government to do what the science says rather than what political medicine wants to do. And so again, I would encourage any of you out there, if you're suffering from lower back pain or sciatic pain and have not been to a chiropractor and are considering taking pharmaceuticals to relieve the pain, I would highly recommend that you consider a chiropractor and consider our office to just come in for a screening just to see if there's a chance that we can help you. And we do those screenings at our expense. It's a subluxation screening to find out, can we help you? Is there a chance that you have what our office can help you with? So our number is 402-488-2220. And if you or any of your friends or family members have problems in this area and you don't want to take pharmaceuticals for us, give us a call. We'd love to be able to just take a look at you and see if we can help you. Next week, I will be out of town, so there will not be another 10 Minutes of Truth next week, but we'll pick it up the following week. I hope you enjoy these articles. I think they're important, and this is the only way that we can get those out to you. So God bless all of you. I hope all of you have a wonderful Thanksgiving next week. We have a lot to be thankful for, and I'll see you in 2 weeks.